To better understand how the patient's home medication list is generated, we will start with a brief demonstration of Horizon Home Meds. While interviewing the patient, the nurse searches for the medication using Horizon Home Meds. In this example, the patient states they take Lopressor for elevated blood pressure once a day by mouth. The nurse enters Lopressor in the search pane and selects the drug. She then enters route, if not already selected, form, dose, strength, and frequency. Additional information regarding drug administration may include indications or special instructions. Once the medication has been entered and saved, the nurse will click Ready for MedRec button to notify physician the admission medication reconciliation is ready for processing. Data will display on the home medication list in the Admission Reconciliation in Portal. We will log into Portal to select our patient. Under the Census tab on the Data Monitor display, you can see the Admission Medication Reconciliation is needed. It is triggered when the nurse completes the collection of patients' home medications. Once the patient has been selected, select the MedRec RX Writer tab to start the process. Select Reconcile Medication. In the admission block, select Start. This will launch the reconciliation process. The list is sorted by home and hospital medications. Medications that may have already been ordered and profiled for hospital use will appear below home medications. Note, the medications listed under hospital medications are already selected to be continued. Let's discuss the icons that are displayed on the screen. The house identifies medications the patient currently takes at home. The equal sign indicates there are duplicate medications on the list. Normally, this icon indicates there are two existing medication order or the patient takes two different doses of the same drug at home. The action buttons to the right allow you to order, modify, not order, or clarify existing medication on the list. Now, let's run through the process. Select to order Lopressor. On this screen, you will be presented with a list of medications to select from. The list generates from the formulary database. Once selected, the populated fields depend on how the medication was entered by the nurse: dose, route, how often, when to start, and for how long. Once the required fields are completed, select Save. The medication appears to the working list on the right of the screen. Select Midodrine to modify for inpatient use. Select the medication from the list. Choose desired dose, 10 milligrams from the drop choices, and save. It now displays on the working list. Select multivitamin and choose not to order by selecting Don't. Notice the medication ipratropium has both the house and equal icons. Look for the duplicate medication in the list provided. Continue the current dose of the inpatient medication. Notice it is already selected to continue. On the home medication list, select Don't, since it's already displayed the way it's needed for inpatient use. Select Zolpidem and choose Clarify. Add comments or directions for the nurse concerning this medication. This will send an automatic order to the nurse for clarification. Once the nurse clarifies the order, she will place a call to the physician with the clarification. At that time, if the physician decides to continue the medication for inpatient stay, the nurse will take that as a telephone order and process it accordingly. Select Percocet to order. Notice the system generates an alert for allergy for this medication that must be addressed before it can be ordered. We'll cancel and select Don't to not order. Continue to address all of the medication on the list. Do not select to save as a draft. Draft orders will not be sent to pharmacy for processing. This will cause delay in patient treatment. Select the Complete button. This will send existing medications from your working list to pharmacy for profiling and would also notify the nurse the medication reconciliation has been completed. This concludes the demonstration of the admission medication reconciliation process.